So coming up, we'll be speaking to Christine Hogendoorn very shortly. Christine is going to talk about the role of the private sector. And let's face it, there is a role for the private sector in Africa, across the globe. Remember, this Africa Health Week is part of a wider series of future health weeks. We've already been in the UK. We've been in the Arabic world. We'll be heading to the USA from the 1st to the 3rd of September. We are all over the globe over the coming months with the primary objective of sharing good practice, listening to ideas like we've done with Jonathan, and connecting all of you so that we've got a vibrant, dynamic community of healthcare professionals, which we know we've got, all connected and joined up and working for the same cause. So I mentioned there Christine is going to join us. Christine is the head of digital health and PPP Africa, that's public and private partnerships to you and I. Africa Health Business is where she's at, and Christine joins us now. Hi, Christine.
Hi, thank you for having me. And thank you for the introduction. So, my name is Christine Hogendoorn. I'm the head of digital health and public-private partnerships at Africa Health Business. And as you can probably hear, I'm Dutch, but I'm based now in Nairobi in Kenya. So over the past 4 years, I've been working across the continent, including West, Central, and Eastern Africa at different capacities at the United Nations, social enterprises, and now at Africa Health Business. It's a boutique consultancy and advisory firm based in Nairobi. And today I'll be talking a little bit about service delivery and healthcare on the African continent. So Africa Health Business was founded in 2015. We're headquartered in Nairobi, but we work across the continent with a team of around 20 staff members in Kenya and a large pool of consultants throughout the continent. So our focus is really on supporting and promoting the growth of mainly the private sector in Africa, with the goal of improving access to quality healthcare and contributing to universal health coverage in Africa. So we really take a holistic approach to the private sector in health. We focus on how the private sector works effectively with key players in health. And our projects really focus on creating greater impact in the African healthcare space by leveraging the private sector. So we do our work through two main pillars: consultancy and advisory, and investments through our recently established investments arm, HB Capital. So on the right-hand side, you see an overview of the services we provide. So under HB Consultancy, for example, we work with clients on capacity building, tailored research, designing market entry strategies, capacity building, feasibility studies, etc. And under Capital, we work with investors, private equity firms and funds. We provide matchmaking services and we work on pipeline and portfolio opportunities. So we really don't invest ourselves, but we identify opportunities and strategically match these to investments with the overarching goal of sustainably growing the business of healthcare. So at HB, partnerships are at the core of our work, and we believe that active participation by all stakeholders is critical to achieving the health-related SDGs. And I would say that really one of our key strengths is our incredible network with governments, government organizations like Ministries of Health, the African Union, Africa CDC, the private sector, NGOs, and the UN. And through this network, we have access to local leaders and local knowledge, which allows us to provide on-the-ground market intelligence and a localized approach. So especially over the past years, we've seen a shift towards engaging the private sector in healthcare delivery in pursuit of the SDGs and sustainability. And we have seen that, especially now during the pandemic, this has been further reinforced, and especially like around the need of the private sector engagement as part of the healthcare delivery system. So when I was asked to talk about service delivery and the role of the private sector in Africa, I learned that the audience attending this webinar comes from all across the world. Therefore, I decided to start with a brief overview of Africa to show how vast and complex the continent is, including one of my favorite images of the continent. So we are often in conversations with clients who ask us if we can help them with projects in Africa. And as you can see in this image, Africa is really not one country, but a continent made up of 54 countries and a size that easily fits in the US, China, India, Japan, Mexico, and many European countries. I find this an incredible image, just showing the size of the continent. And furthermore, it also underlines that when talking about service delivery in Africa, this is not as straightforward as it may seem. So looking at the African healthcare sector in general, what I find really interesting is that the private sector already plays a very important role in healthcare delivery. So in general, private resources or private sources represent more than 90% of the financial flows into emergent markets. And in the African healthcare space, around 60% of healthcare is financed by private parties, and over 50% of services are delivered by private facilities. So these consist mainly of small and medium enterprises, and they're accessed not only by the rich, but also by the poor and rural populations, or I would say even mainly by those populations, who are often underserved by the public sector. So, for example, in Ethiopia, Kenya, Nigeria, and Uganda, more than 40% of people in the lowest economic quintile of the population, and often in remote areas, receive healthcare from private for-profit providers. So this really shows that the role of the for-profit sector in providing low-cost services, unlike the more common high-end private care providers, plays a really important role in coming up with innovative approaches to healthcare delivery to minimize costs without compromising on quality and also on patient experience. And what we've seen is that these initiatives also really help lessen the burden on the public system, and they play an important role in last mile delivery. So who is the private sector in healthcare? So here you see an overview of the different stakeholders that make up the private sector across Africa. The formal part of the private sector includes for-profit commercial organizations, non-profit organizations, and social enterprises. And in contrast to many developed countries, the informal sector really plays an important role. It's often not well documented, and it's active especially among rural and poorer populations. And it includes healers, midwives, or individual medicine sellers. And this also shows that the private sector is not as straightforward as this may sound. And especially when policymakers seek to effectively engage with the private sector, they need to find innovative ways to engage with the formal, but also the informal sector. So on this slide, I've shown an image by WHO, and it shows the 6 health systems building blocks that are making up the health system. So as you can see, regulation and oversight are placed at the heart of effective, high-quality delivery of healthcare. What this also shows is that it's hard to look at service delivery in isolation. And all these parts are connected, and they have to function together to be effective. So, for example, if you adjust something in human resources, that will also affect service delivery. And it is really up to governance to come up with a clear framework and to create an enabling environment. So, as we have seen in the previous slides, the African continent still faces a continuing healthcare gap. So in service delivery, Africa faces a shortage of infrastructure and facilities and insufficient trained medical personnel and the so-called brain drain. And it's clear that governance cannot achieve universal health coverage without the private sector. And we feel that a reassessment of traditional approaches is really needed. So as we've seen, the private sector already plays a very important role in service delivery, but the private sector also faces its own challenges. What you can see across the continent is that the private sector is very fragmented and faces a lack of accreditation. And this, combined with a largely uninformed population, this may lead to unethical business practices. And the region is also facing or plagued by substandard drugs or counterfeits that often result from small-scale manufacturers without the right skills or permits or technologies required to produce a certain standard. And overall, we feel that the healthcare sector would benefit from a more formalized, integrated, regulated, and better capitalized private sector. That also requires increased stewardship from not only the public sector, but also other stakeholders. So how can we effectively leverage the private sector in service delivery? So when appropriately regulated, the private sector can contribute to a higher efficiency and quality standards by competing with each other and by complementing, but also providing competition to the public sector. So even those with concerns about the private sector in healthcare are increasingly recognizing the important role that the private sector can play in Africa as part of the overall healthcare system. So there are many areas where the private sector can play an important role. On this slide, I've highlighted some of the key recommendations and suggestions around service delivery. So at governance level, it's important to create an enabling environment and develop and enforce quality standards. And what we think is that initial efforts at enhanced regulation can really have large and very immediate benefits. So around financing, we think that it's really important to engage and enable the private sector to strengthen components of health financing, such as mobilizing resources, purchasing services, or risk pooling. And this all can lead to greater financial risk protection. And we've seen that not only the public sector, but also donors and the development sector plays an important role in the health financing ecosystem. And we would really like to see a more closer engagement with the private sector. So around service delivery, we see a couple of areas where the private sector can be leveraged more effectively, such as around ensuring that policies and regulations that support and mobilize the private sector can be streamlined, for example, around reducing tariffs or important barriers. And we feel that local institutions, financial institutions, should be encouraged to lend to local organizations, and then in particular those very important small and medium-sized enterprises. And in order to work effectively with the private sector, we also feel that capacity building is key. And local governance needs to be trained and strengthened and understand how the private sector works to really expand their procurement capabilities and manage those contracts with the private sector. So to conclude my presentation, at AHB, we really believe that the private sector is very key in delivering effective healthcare. However, it's also important to recognize that each country is different and they're all at a different stage of their UHC journey. And it's key to look at the local context and develop leaders that can drive change from within, and really building on existing efforts rather than duplicating efforts. So at AHB, and I'm always open to explore how we can support your organization and your specific needs. So please feel free to reach out to me if you're interested in working together with us. And I would really like to thank you all for listening to my presentation.
Thank you, Christine. And some challenges there, I think you were highlighting, but also some things that are already happening that are working well. And I guess for you, it's about making sure that those challenges are met and that those positive partnerships are enhanced and that they become more mainstream.
Yeah, exactly. Yeah.
So when we think of the private sector, sometimes people in the public sector feel a little bit threatened because we wonder why the private sector is motivated. We wonder whether it's money that motivates them, that maybe they aren't really fully invested in, perhaps like with healthcare, you know, the patient first. Are they looking at profit first? What would you say to that?
I think a part of the private sector is motivated by money, not like, as I mentioned, like there are different stakeholders in the private sector and not all of them are motivated by financial incentives. And I also don't think that it's a bad thing. I think the private sector has allowed a lot of innovative approaches to come in. Thanks to the private sector, a lot of equipment is now available to many facilities in Africa. And as I mentioned, also like in areas where the public sector is not always available, the private sector comes up with really innovative approaches to reach those underserved populations. So I understand where the public sector is coming from, and also I feel like it's really key to work with the private sector and to educate the private sector or the public sector on how the private sector works, and really trying to strengthen the healthcare system together and showing that it's not something to be scared of. Yeah.
Well, and let's flip that now. You mentioned, you know, there might need to be more understanding of the public sector's view on the private sector. Now let's look at the private sector's view of the public sector. Some would argue that they would say it's full of bureaucracy and red tape and that nothing ever happens quickly and things have to be decided by different committees, and why can't action be taken now? Why do we have to wait? What would you say to that?
No, definitely. There's also, I think it would be great for the private sector to also get a better understanding of how the public sector works. And I think there's also a real challenge there, is why I think, like, as HB, we do a lot of work around creating a better understanding for the private sector on how the public sector works. We organize stakeholder sessions, roundtables, etc. And one of the challenges that our clients are having is understanding these different frameworks and policies and rules and regulations. And that's actually highlighted as one of the key areas when they want to come in with their solutions. So there's definitely also some work that needs to be done the other way around. Yeah.
Yeah. I have some experience of bringing partnerships together, because that's what we're talking about here, isn't it? It's about bringing partners together from public and private sectors, you know, so that we can advance. That's what we all want. We all want things to improve. But quite often, you know, there are personality clashes. There are clashes over different people's agendas, over different priorities. Do you see, therefore, I think you're perhaps advocating the role of almost mediation and moderation about someone independent or an independent body, you know, being the conduit that joins all this together?
I don't know if it's necessarily an independent body, but I feel like for our organization, we speak different languages. We do a lot of work with the development sector, with the EU, with USAID, or the US-based organizations, with the African Union, Africa CDC, different ministries of health, and it's really sort of understanding those local contexts and understanding those local challenges and trying to sort of bring everyone together. I think that's really important, like really truly understanding what's going on the ground and what are the different needs. Yeah.
I think we saw that, didn't we, particularly, and still see it during the pandemic, where there was this crisis. There's no other word for it, where the public sector was crying out for support wherever it would come from, and the private sector was mobilised very quickly, wasn't it? Particularly, or in some cases not quickly enough, in terms of perhaps PPE, drug development, vaccine development, support for staff. Staff relief, all of those things. There's a knock-on effect, isn't there?
Yeah. No, I think what we've seen during the pandemic is an incredible ramp-up of the private sector, as governments are realizing that they cannot respond alone to the crisis. Like, for example, in Kenya, the private sector, Alliance CAPSA, has really been at the forefront of understanding the COVID pandemic and trying to engage the government to come up with appropriate response measures. And as HB, we are part of numerous partnerships and task forces that strengthen vaccine drives and testing and treatment capabilities. And I think the private sector has really proven its value also there to the public sector, and I really think that this way of working is also here to stay. So, I think it's an incredible sort of ramp up from the private sector.
So, and let's stick on COVID-19. Do you believe that that's changed the future of the way healthcare will be designed and delivered?
I think in Africa, yes, on the continent. When looking at sort of the different challenges that really came up during COVID-19, such as local manufacturing or the trade barriers, etc., and also working together internationally, coordination between the different countries, those things have really come up, and I think that's an amazing thing, and there's no way back, so to say. So we have to work together. We have to focus on like our local capacities and capabilities and further strengthening and enhancing those. And it's definitely changed. Yeah.
And you must have some great examples of where the private sector has added value and brought some positivity or some solutions to the healthcare sector. Can you give us a couple of examples, maybe?
Yeah, so like I mentioned, in Kenya, which is where I'm based, like I think the private sector has done an amazing job in working together with the government in combating this virus. So there's been like a national task force that includes the private sector, the public sector, the development sector, etc. And they've really been at the forefront of coming up with measures and rules and regulations. So I think Kenya has done an amazing job at sort of trying to contain the virus in the country. And then also what we see sort of at the African-wide level, how Africa CDC now works together with the private sector in the distribution of the vaccine. I think they're doing an amazing job reaching out to different partners, including the private sector, trying to build the capacity of local hospitals, local organizations. So I think that's also an amazing example.
I guess my final question is that how are we ensuring that the challenges are being met? There must be plenty of challenges for both the public and private sector, and the public and private sector working together, particularly around ensuring equal access for people and countries, particularly the poorest people.
I think it's already happening a little bit, or not a little bit, but it's happening. I think it's mainly around like really improving that sort of the dialogue between the public and the private sector, creating more transparent frameworks, making it sort of easier for the private sector to understand where they can come in, how they can contribute, and also, like you mentioned, like vice versa, like how can the private sector make them understand how they can better work with the public sector. And we have seen like a massive shift over the past couple of years from international development organizations as well, really looking at the private sector and coming up with sustainable solutions. And I think that's also an amazing and very necessary shift. Really realizing that the private sector is not something to be scared of, but by designing market solutions based on the needs of the local in the local context, you can come up with a truly sustainable solution. Yeah,
I think that's the perfect way to wrap things up. Talking of a sustainable long-term solution, the fact that there's nothing to fear here. This is we're all on the same page. We all want the same thing, and the way you articulated that is excellent. And keep up the good work, Christine. I'm sure you will.
Thank you. Thank you so much for having me.
Yeah, thank you for joining us. That's Christine Hogendoorn, who's just highlighted there the role of the private and public sector in Africa and, of course, across the globe as well. So there we are. What a morning session we've had. 3 fantastic presentations, all of which will be uploaded to the Future Health YouTube channel for you to watch and enjoy again. You'll be able to analyse them a little bit deeper. And if those presenters have shared their contact details, you'll be able to freeze frame their details and get in touch with them if they've invited you to do so, not just from today, but of course yesterday as well, and what's coming up this afternoon and tomorrow. You'll be able to view all of those presentations again. Remember, you can stay on the platform, carry on networking, carry on chatting. Later on, we'll be coming back with a couple more presentations. And also, if you want to stay on social media, just follow the hashtag Africa Health Week or hashtag Future Health. And you'll find other people there chatting away. So there you go. Brilliant morning. Lots to enjoy, and look forward to coming up after our next break, which is for lunch, actually. So we'll see you back here in about an hour and 20 minutes time.